So I've divided this up. The first one I always look at is are there any organic or biological explanations for this patient's presentation with what looks like CRPS? So these are the most obvious ones. So number one, do they have CRPS? If yes, is it type 1? Is it type 2? Is it NOS? If you don't think it's CRPS, is it some sort of neuropathic pain or nerve pain affecting the limb? Is there a nerve injury? Have they, had a nerve transected or damaged or avulsed or something? Is there a peripheral neuropathy? Is there an entrapment of a nerve? Is there a neuroma? Now, a neuroma is basically a small ball of abnormal nerve cells, which when you press on them can be extremely locally painful. Is there inflammation? Is there some neuropathic pain and mixed with some nociceptive pain? Or actually, is it none of those things? Do they have something completely different? And medico-legal cases recently that I've been working on, one case, the patient had gout, and that was purported to be the cause of their symptoms. They didn't have gout because they ended up being trawled through by 2 rheumatologists, and there was no evidence of gout, but it was suggested. And the other one is arthritis. The second big classification is psychological and psychiatric issues. Now, I'm obviously a pain consultant. I'm not a psychiatrist. So I'm really going to move through the list more than anything else. But what is possible is mood disorders. I've seen SSD on the range of opinion for CRPS. That's somatic symptom disorder. We've got adjustment disorder, conversion disorder, and factitious disorders. Now, if you wish, if we have time at the end, we can go through those in a bit more detail. As I said, I'm not a psychiatrist, but what I have done is I've tried to put a brief definition of what each one of those are. And if it is suspected that a patient may have one of these, they would definitely have to have a report by a consultant psychiatrist to look at the range of opinion here. What I found interesting going through these is a lot of these disorders are what we call unconsciously motivated. So the patients can have these disorders that are listed, but they're not aware of them. They're not aware that they have them, but consciously they will produce symptoms in them, apart from malingering, of course, which we will talk about in a little while. The other thing that's very interesting, and I have to be honest with you, I've not seen this in clinical practice, but when I was digging around what some of the other potential psychological and psychiatric issues could be that could explain CRPS, what I found was an awful lot of literature in the hand surgery domain. And there was some very interesting specific conditions that I'd not come across before. So we got factitious edema. Well, that's going back to people putting ligatures on, factitious lymphedema, factitious wound creation, which we talked about before, actually creating their own wounds. Psychopathological CRPS. I really couldn't find very much about this, but it is described. And this one at the bottom that was interesting, clenched fist syndrome. So these are people going to pain clinics, to hand clinics, sorry, who literally stand there all day, every day, clenching their fist as hard as they can. And they have really peculiar contractions in their hand. Now, that's primarily a psychological or a psychiatric condition, but clearly that manifests physically. Another, and of course, this is the question. This is the question you will be asked in your medical legal cases. So, doctor, there's no biological cause. There's no organic or biological disorder here. There's no psychological disorder, or we can't find a psychological or psychiatric disorder. What are you left with? Well, essentially, we are looking at the possibility of deliberate faking or malingering. And interestingly, the ICD-11 has its own description of malingering as a healthcare issue. So obviously, this is malingering is feigning, intentional production, or significant exacerbation of physical or psychological symptoms. And essentially, it's for secondary gain. It's to get out of work, to get out of going to jail, to obtain medication, to get money, to get through the medical legal process, all sorts of reasons for doing it.